Rheumatoid factor, or RF, which it is commonly known as, are autoantibodies produced by the body in reaction to certain conditions. Most commonly, this particular test is done to diagnose rheumatoid arthritis. In this tutorial, we will use the principle of latex agglutination to detect RF in a patient's blood or serum. A test card is provided in each RF test kit that contains 6 circles. For one circle, you will label P for positive control, the next circle N for negative control, and the other circles, depending on the number of test samples that you have, you will label the circles based on the lab ID number, your hospital ID number, or maybe the patient's name with the age and gender. In the area denoted by the letter P for positive control, you'll add 1 drop of positive control reagent. In the area denoted by the letter N, you'll add 1 drop of negative control, and in the rest of the circles, you'll add 1 drop of the test sample individually. For example, if you have 3 test samples, then you'll add test sample number 1 to the circle denoted by the number 1. From the sample test number 2, you'll add to the circle denoted by the number 2. From test number 3, you'll add to the circle denoted by the number 3. Next, you'll take the latex reagent and add 1 drop each to the positive control, to the negative control, and to the rest of the samples. And using a plastic stick stirrer provided in the kit, you will stir the samples within the region of the circle. If you have a rotator in your facility, you can place the test card on the rotator and allow it to rotate for 2 to 3 minutes. In facilities without any rotator, you can manually rotate with your hands up to 2 minutes. Results should be read within 2 minutes. Results interpretation. Positive tests will be denoted by visible clumping with a clear background. This is agglutination. In a negative test, you will not see any clumping. There will be a cloudy appearance of the solution or the mixture. These findings you'll find in the positive control and in the negative control. For valid tests, the positive control should show clumping, whereas the negative control should not show any kind of clumping. For interpretation of results, you can compare the clumping of your test samples with the clumping in the positive control to make it easier for you. For invalid tests, there will be no clumping in the positive control, or there will be clumping in the negative control. In such a scenario, please repeat the test once again in a separate test card. If the same continues to occur, then there must be a problem with the reagents. Please check the expiry. If the reagents are not expired, then most probably the reagents may have been damaged. An important side note, for tests using the principle of latex agglutination, please go through the manual insert carefully and see the sensitivity limit or the sensitivity detection limit of the test kit and interpret it according to that. Mention the sensitivity detection limit in your test report to make interpretation for the clinicians easier.